Welcome to TMZ. Look who we caught from N193.
Oh, do you have an NSAID?
Nsaids, non-steroidal anti-inflammatory drugs.
NSAIDs? What's an NSAID?
Well, after tissue damage, prostaglandins are formed with the help of two enzymes called cyclooxygenase type 1 and 2, also called COX-1, COX-2. Aspirin and ibuprofen-related drugs inhibit both COX-1 and COX-2. Because the COX-2 enzyme is more specific for the synthesis of inflammatory prostaglandins, the selective COX-2 inhibitors provide more specific and peripheral pain relief. Celebrex is the representative of COX-2 inhibitors.
Okay, English, please.
Yeah, thanks,
English.
Professor. I didn't understand
I
any of
don't, what does that mean?
Do you have any other way to say it, Professor? Somewhere we can understand?
Mr. Professor.
I know, come on.
Mr. TMZ. Professor of the Year.
Liar! Liar!
NSAIDs are used to control mild to moderate pain, fever, and various inflammation conditions such as rheumatoid arthritis, osteoarthritis. Ophthalmic NSAIDs are used to decrease postoperative ocular inflammation, also to inhibit preoperative meiosis, and to decrease inflammation due to allergies.
After taking an NSAID, the pharmacokinetic action in the body.
Hi, I'm Payne, T-Payne.
Hey.
Your receptor site looks pretty sexy right there. You wanna hook up?
Oh, look who came to block pain reactions. Someone must have a prescription, cause it's Dr. Celebrex.
Hey, what up?
Ew.
I didn't see you here. Sorry.
No. Alright.
Aw, poor Pain. No one ever wants him. Pain got rejected. Too bad Celebrex causes
back pain, peripheral edema, abdominal pain, dyspepsia, flatulence, dizziness, headache, insomnia, hypertension, increased risk of cardiovascular events, acute renal failure.
Hi, I'm Payne, T-Payne. You Nsaids be looking good on that tree. Wanna hook up?
Pain, get out of here. No one wants you. Come on, Enzymes. Let's go.
access denied. Sorry, Pain. Please beware that aspirin may cause stomach pain, heartburn, nausea, vomiting, tinnitus, prolonged bleeding time, severe GI bleeding, bronchospasm, anaphylaxis, hemolytic anemia, Ray's syndrome in children, and metabolic acidosis. Pain at it again. Trying to send those signals to COX-1 and COX-2 enzymes.
That's not happening on my watch.
Bye-bye, Pain. If you have any of these side effects, please talk to your doctor. Dyspepsia, dizziness, headache, drowsiness, tinnitus, rash, pruritus, increased liver enzymes, prolonged bleeding time, edema, nausea, vomiting, occult blood loss, peptic ulcer, GI bleeding, anaphylactic reactions with bronchospasm, blood decreases, renal impairment, MI, heart failure, or hepatotoxicity. Even though there are side effects to these drugs, there are nursing implications to offset the risk. Real-world nursing implications.
Hi, my name's Victoria. I'm going to be your nurse today. I just wanted to tell you some nursing implications for Celebrex. So I'm going to be assessing your range of motion, degree of swelling and pain in the affected area before and during the therapy. I'm also going to assess, do you have any allergies to sulfonamides? No. Okay. Aspirin or NSAIDs? No. Okay, good. I'm also going to check for rash frequently during the therapy and discontinue it at any sign of rash. Okay, and for ibuprofen, Do you have asthma, aspirin-induced allergies, or nasal polyps? Okay, good, because that would, put you at risk for developing hypersensitivity to it. I'm also going to check for rhinitis, asthma, or urticaria. Okay, and then I'm going to also assess for signs and symptoms of GI bleeding, renal dysfunction, and hepatic impairment, especially with ibuprofen. I'm also going to, again, check for rash frequently and discontinue at any sign of rash. Okay, and for aspirin, I'm going to, assess if you have asthma, allergies, and nasal polyps. I'm also going to assess for rash again during the therapy and assess your pain and limitation of movement, noting the type, location, and intensity before and at the peak after administration.
Thank you for watching TMZ, Total Medication Zone. Have a nice day.
Aspirin and NSAID usage has been associated with gastrointestinal toxicity, including bleeding ulcers. Certain NSAIDs, selective COX-2 inhibitors, have been linked to an increased risk of cardiovascular events, in particular heart disease. In addition, chronic use of some types of NSAIDs have been associated with kidney damage, and that may persist even after drug withdrawal in some cases. So beware. NSAIDs are here.
Nsaids on 3. 1, 2, 3.
Nsaids!